Hello, everyone. I'm here with another live and unedited video to answer a question that I think is on many of your minds. And the question is, can I get better from vestibular migraines? And this is a little bit of a contentious topic because I think my own views of it were influenced by my medical background up until very recently. So in the view of most of my colleagues in audiology and related disciplines, migraine and triple PD are related, but not the same thing. Now, there's general acknowledgement among the medical community that triple PD, MDDS, chronic dizziness are all complex biopsychosocial conditions, aka they acknowledge that there's some neural circuit component that can be modified. Although, again, we've talked about before, the medical community doesn't have good answers as to how. But migraine is viewed a little bit differently. Migraine is viewed as a complex but primarily biological condition that is highly influenced by genetic factors. And as such, it's not viewed as something as psychosocial as the neural circuit dizziness forms that we just talked about. So I think I was also influenced by these views, but my views have definitely changed. And some of those views changed because I myself have suffered from migraines since I was a teenager, and now I no longer suffer from them. I give you guys a lot of advice, and if I'm going to make you do stuff, I better do these things myself. And I can tell you that the very techniques that I ask you to apply to yourselves are the same techniques that have freed me from my migraines. They were not vestibular migraines, but they were migraines. And I've also had the great honor of working with several patients who have vestibular migraines who have also gotten better. And I wanted to share with you these incredible results. And this is from a client of mine, a patient of mine who I've worked with in person, who is, by the way, an absolutely remarkable person. And one day I'm going to get her on here for an interview so you guys can meet her. But in the meantime, she is one of my YouTube viewers. So if you like this video, make sure you say hi to her in the comments. I think she'll read them. So this patient has had vestibular migraines for several years, and she has gone through periods of extraordinary stress and difficulty in her life. But it all kind of came to a head when the migraines started a few years ago. And when they started with a drop attack, which basically meant she was completely incapacitated. She was in the hospital. They did all these tests. Everything was normal. No one could explain what had happened. And finally, through many, many tests, many, many doctor's visits, she was finally diagnosed with vestibular migraine, actually by one of my former students, which is a very strange twist to the story. But since that time, this patient has suffered from absolutely debilitating symptoms. So sometimes they would come on and they would go away relatively quickly, but other times when the symptoms came on, she would find herself couch ridden for weeks at a time. No exaggeration, she would be just completely incapacitated. And the attacks would, again, come randomly, come out of nowhere sometimes, although of course she had known triggers like walking and being out in public, which, are things that we'd like to be able to do. So this patient has basically been struggling and getting by. She had an anti-anxiety medication that could help with some of the symptoms, but she wasn't taking any migraine medications, and basically she was just living this way. So I started working with her a few months ago, and I gave her this test, this outcome measure, when we first started working together. So this is called the DHI, the Dizziness Handicap Inventory. And what it measures is the patient's perception of how the dizziness is affecting him or her functionally. So it has a few different domains. It talks about emotions related to the dizziness. It talks about feelings or emotions related to the dizziness, and as well as just performance, like daily activities. So her before score was 62. So that is in the high-end severe handicap area. That's in the severe handicap territory. And that's probably not surprising to you to hear based on what I just told you about how debilitated she was by her symptoms. So now, these are the results from last week. You ready? Okay. So this is her DHI from last week, and this is her score now, which is 14. 14 is considered in the range of normal. It's considered no handicap. So she went from being debilitated to now basically the only thing she still has trouble with is very strenuous housework or yard work, but she said only some of the time. And then occasionally going to supermarkets. Basically, those are the biggest problems she has now. But everything else, walking around in the dark, being stressed, being depressed, it interfering with household chores, getting out of bed, restricting travel, feeling frustrated. She doesn't have any of those problems anymore. So the answer to this question is yes. The answer to the question whether you can heal or get better from vestibular migraines is unequivocally yes, you can. Yes, there are biological factors, but you have control over what parts of your biology are expressed. You have control over your gene expression. So yes, you may be genetically inclined to getting migraines like I am, but that doesn't mean that you are condemned to having them. That doesn't mean that the only thing you can do is manage them. No. If you follow the techniques that we talk about on this channel, if you recognize that neural circuits are playing a huge role in the symptoms you have right now, you can learn not just to manage your symptoms, but reduce or eliminate your symptoms, just like my patient did. And by the way, this was in a few months. So imagine where you could be in a few months. Okay, so I hope that that was a helpful video for you. And I'm sure I may have just made some medical professionals angry, and that's okay. You are welcome to share your thoughts and feelings with me in the comments. But as always, guys, thank you so much for tuning in, and I will talk to you soon. Bye-bye.